Hearing me now? Good morning again, everyone. You're looking beautiful down there. I would like to take the time to say thank you for inviting me today to present on such an important topic, breast cancer awareness. And as we all know, October is Breast Cancer Awareness Month, and as such, it is very important to take the opportunity to empower others, our families, and our communities. As a nurse and a self-care advocate, my goal is not just to share information, but to encourage action and self-care practices that could potentially save lives. Now, breast cancer is one of the most leading causes of death worldwide in women. We all can agree, right? But it is not limited to women alone, so men can also get breast cancer. So this presentation is for everyone, not just females, okay? And I'm going to ask you to be very interactive because I'm going to be doing just a little practical parts. I'm going to ask 5 volunteers, 6 to be clear. So I'm going to ask one person to volunteer when I'm going to be doing this self-breast examination. Well, you're going to be demonstrating, so nothing too technical. So I'm just going to ask for your participation. Thank you. Now today we're going to be looking at what is breast cancer, signs and symptoms of breast cancer, risk factors, screening methods, and how to perform a self-check exam at home. And it is very important. This is primarily one of the most important steps. So I'm going to want you to pay attention, okay? Now, breast cancer is a disease in which the cells of the breast grows abnormally and uncontrollably, forming a tumor. And as I said before, it is not just in women, but also in men. Now, 2 of the signs and symptoms of breast cancer, of breast cancer are as follows, and we're going to talk about a little bit of them. Can anybody share, by raise of hand, what are some of the signs and symptoms that you know when somebody has breast cancer? Anybody? A lump. And that's the first one I have on my list here. So a lump or a thickening in the breast, and not just the breast, but also the underarm area. The second one is swelling or change in the shape of the breast. Next is dimpling or puckering of the skin, and this tends to look like orange peel. So you know how the orange looks outside, a bit shrivelly and wrinkled. That's what I'm talking about. The next one is nipple discharge that is not breast milk, and inverted nipple or changes in the nipple position, and also persistent pain in a specific area of the breast. So these are signs that may indicate that someone is experiencing breast cancer, but they are also not indicative. So it can be something else that is causing it. So if you are having any of these signs or symptoms, I am imploring you to visit your healthcare provider. Now, there are some factors that are risk factors, and basically risk factors put you, I don't want to use the word risk, but more at risk of getting breast cancer. And I'm going to ask again by raise of hands, can anybody tell me some of the factors that you think can cause breast cancer or are related to breast cancer? By a raise of hand. No one? No, risk factor. So, alright, I'm going to go into it. Yes, that is definitely one. So the first one here I have on the list is age. And as you grow older, you are more at risk of developing breast cancer. And statistics shows that persons over the age of 50 years old are more at risk of this, of developing breast cancer. Also, a family history. So for close relatives, if somebody in the family has breast cancer, you'll realize, and it's a trend, maybe every other generation, that is also a risk factor. Genetics as well, so mutations in the genes. And there are 2 specific genes, I'm not going to go into the biology of it, but there are 2 specific genes, they're called BRCA1 and BRCA1 and BRCA2. And I'm not sure if you are aware of this celebrity. Her name is Angelina Jolie. She, in her, I think, late 20s or early 30s, she realized, after doing blood tests and so forth, that she had the BRCA1 genes. So what she did was that she went ahead and she removed both her breasts. She didn't have a problem at the time, but because she has the genes, then definitely she would be getting breast cancer. So that's what she did. Next is hormonal factors. So early menopause is also a risk factor, as well as late menopause or hormonal therapy. And the final one I have here is lifestyle factors. So your diet. Persons are always talking about, eating healthier, but it's very important. It's not necessarily going to be curing. We cannot necessarily cure everything that we have, every ailment, but the fact remains that preparation or primary care, pouring into yourself and giving yourself a healthy diet plays a very important role. And if you don't prioritize health, you're prioritizing illness. And I'm sure it is best for you to prioritize health before illness, right? Okay. So poor diet, lack of exercise, alcohol consumption, and smoking, those are also some of the risk factors. So I'm hoping that you're exercising and not consuming too much alcohol. There's a balance in life. Smoking, I hope you're definitely not doing so, because smoking can also cause other types of cancers. All right, so although some of these factors are beyond our control, adopting a healthy lifestyle and staying vigilant with screenings can reduce likelihood of the severe outcomes. Now, some of the screening methods that are available for breast cancer are, by a raise of hands again. So, Sister Jacob? Mammogram. All right, so bright students this morning. Mammogram is actually the first one I have on the list here. And it is recommended annually, so once a year, or in some cases twice per year, for women who are over the age of 40, sorry. So if you're over the age of 40, you're supposed to be doing your annual mammogram. I know a lot of persons shy away from it because they say it's painful and the procedure is not pleasant, but it is important. We're getting to it. Since you already spoke, since you're the one who spoke about the examination, I'm going to ask that you be the volunteer. All right, so the next one I have here is ultrasounds, and often an ultrasound is recommended after you have found a lump. So after doing the examination, and if you find a lump and you go to your healthcare provider, then they will recommend for you to do a ultrasound. The next one is an MRI, and this is done after the ultrasound. So if the lump was found, you did an ultrasound to get further information of what's happening in the body, then they will recommend an MRI. A clinical breast examination is also a good means of checkup. So if you're going to your doctor annually or twice per year, most persons would go to their gynecologist. This is also a part of the checkup. And the last one I have here is self-breast examinations, which is very, very important. It is very simple, but it's very important. So by a raise of hands, I want to see how many persons perform a monthly self-breast examination. Nobody? Remember, our bodies are the temple of God. So if God gives us, exactly, Pastor said, remember to take care of it, which is true. He encourages us not only to pour spiritually into ourselves, but if He is giving us our vessel, I am only expecting that we're supposed to care for it. And as such, self-breast examination is very important, very simple to perform, and I'm going to ask for my first volunteer to come up. Sister Diane. Yes. I'm going to ask you to step up. I'm going to run through the steps of how you can perform this at home. And I'm going to ask everybody to pay attention because this is something that I am imploring you to include in your lifestyle. Okay? Come, Sister Dan. Okay, so let us look at what it entails. Alright, so it's important that we do self-breast examinations once a month. And this is ideally to be done after a menstrual cycle. So a few days after your menstrual cycle has ended, this is when it's supposed to be done, and that's when the breast is less swollen or tender. Also, for persons who are not experiencing a menstrual cycle, you can basically schedule a day out of every month and do it on that specific day. So you would have been able to recognize if there are any changes every single month. All right, so let's go into the steps. Step number one is that you are going to do this in front of a mirror. So you want to look. The first thing we're going to be doing is assessing. So you want to look to see if there are any visible changes with the breast. So you're going to stand or sit with your arms at your side. What a good volunteer. At your sides. Look for any changes in the shape, the size, or color of the breast. So you're going to align yourself in front of the mirror and you self-examine. And then you're going to raise your arms over your head. Both of them. Yeah. Over the head, and when you do this, you're going to be looking for wrinkling. So you're going to be looking for what I call orange peel. So if it looks wrinkled, or if you're seeing any abnormal looking changes. And if you do this every single month, it is going to be obvious when there is a change. Yeah, you can put down your hand now. But we're not finished. Secondly, you're going to be examining yourself in the shower. So you're going to raise your one arm, yes, and use the opposite hand to feel the breast tissue. And the breast tissue is not only centrally, but it also extends to the underarm area. So you're going to be examining from that area. And then you're going to, continue, yes. And then you're going to use the pads of your fingers and move in a small circular motion with light to medium pressure. Because you want to apply a little bit of pressure so you can feel properly. And then you're going to do this motion until you cover the entire breast area and under the armpits. The next one, and you're going to do this for the other side. So you're going to raise the opposite hand and use the opposite hand to do the same thing that you would have done on the other side. And everybody is following? Yes. Okay. Simple? Simple? Yes. Okay, great. The next step is lying down. So you're going to lie down with a, you can't do that now, but the next step would be to lie down with a pillow under one shoulder and to use the opposite hand to feel the breast in the same pattern that she was doing just now. And at the end, you would do a little squeeze of the nipple gently to check for any discharge that is coming or might be coming from the nipple. Thank you very much. I appreciate your... You wasn't sure about volunteering for a clap. Okay. So, I couldn't finish. I'm not going to take too long with the presentation today because I don't want to bore anybody, but I am imploring you to start doing your breast examinations on a monthly basis. And it would be so bad of me to come today as a self-care advocate, always preaching about self-care and not encouraging everybody, not just to pour into yourself spiritually, but also physically, taking into consideration your nutrition, your physical activity, your emotional support, rest and relaxation. And for those persons who have people with cancer in their family, remember that compassionate care, patience, and encouragement makes a very, very significant difference for those persons. Now, before I close, I have a little activity, and I want everybody to pledge. And I want you to pledge to yourself today. I'm going to ask for 5 volunteers to step up, and you're going to be writing on the whiteboard what you pledge to do on a monthly basis for yourself as it pertains to your self-breast examination. First volunteers? First volunteer? You can come, young miss. You don't have to be, yes. 5 persons. And this is your pledge to yourself. So you're not doing this for anybody else, which is why it's called self-care. I'm going to hold it for you. She's going to be sharing it with you all. But for persons who are not coming up, I'm asking you to consider what you're going to be doing for yourself. That is okay. The important thing is that she has made her pledge.
Okay, so I pledge to do a self-examine every month on my breast. Yes.
And when are you going to be doing it?
Every month.
When? Yes. So after the ending of your menstrual cycle, a few days after. Excellent. You're learning. Learning is taking place. Next 3 volunteers, and remember, you do not have to be a female to come up. Males need to check their breasts as well. You didn't read yours.
Well, I pledge to be consistent in doing my breast examination.
Excellent. Give her a clap, because that is what a lot of us lack, consistency. So you can start, but you don't always continue. So consistency is a very good thing. Discipline and consistency, they go hand in hand. So you start this month and you come back again next month. You're not really going to do it? Very nice.
I pledge to do monograms every month.
Give her a clap. When she's 40, she will start. But the fact is that she was listening and she has garnered something from the presentation. 2 more persons?
We need a male now.
A male, yes, we want 2 more males. There are lots of males in here. Step up. Pastor, you can come to, yes. Boy, it's a good thing that pastor is a pastor, not a teacher.
Alright, so my pledge is to encourage all the females and males as well, but mostly the females that I come in contact with to do a monthly self-examination of their breasts.
And I hope that you will hold him to his word. So on a monthly basis, you can encourage your congregation to remember, and any female you come in contact with, and male. Excellent. And the final volunteer? Final person is going to come up? Okay, come sister. Sister Jacobs.
My pledge is I pledge to eat healthy and to eat what I need to put into my body to keep out cancer. Because guess what? I have a niece. She's 25 years of age and she did her took off her breast last Wednesday because she had breast cancer. So breast cancer has no respect of age. Amen.
Thank you, Sister Jacobs, and I wish your niece all the best. Give her all the support that you can because it's a very, very rough time for her. And in closing, ladies and gentlemen, early detection through awareness and self-exams saves lives. Breast cancer is a challenge, but we are not powerless. Take the time each month to perform your breast examinations, stay up to date with screenings, and encourage your loved ones to do the same. As a self-care advocate, I want to leave with you this thought. Your health is your most valuable asset. Take care of it, cherish it, and prioritize it.
Thank you.